2 diabetes is the most common form of diabetes, and millions of Americans have been diagnosed, but millions more are also unaware that they are at high risk. Well, Diabetes Alert Day is Tuesday, and it's a one-day wake-up call that's sponsored annually by the American Diabetes Association. Well, joining us this morning from Gundersen Lutheran to talk about some of the symptoms and the risks is Dr. Mary Frohnauer. Thanks so much for getting up with us.
You're welcome.
What are some of the things that make people a high-risk candidate?
If you look at yourself, there are a number of risks that you can identify easily. Age is one of them. If you're over 45, that automatically begins to put you in the high-risk category. If you are overweight, and over half of Americans are overweight, that's another big risk factor. Your background, if you are American, if you live in America and are Native American, African American, Southeast Asian in background, or Latino, that puts you at higher risk to start with. If you are a woman and have had a baby who weighs over 9 pounds, or if you had gestational diabetes, you're at high risk. And if you are a couch potato, you're at high risk. If any of those factors are a check mark yes for you, you should be screened.
And I feel like when you're talking about some of those, age, family history, ethnicity, those are kind of the uncontrollables. But there are some controllable things that you can take into your own hands and help reduce your risk. And what are those?
Exercise and eating right so that you control your weight. Those are things that we all should do, whether we have risk for diabetes or not. But if you are at high risk, the stakes are even higher. The rewards for doing those things and living healthier are even greater than for the average person.
And for someone that is living with type 2 diabetes, how is their life changed once they are diagnosed?
You get a lot more things you have to think about doing, more doctor's appointments, more lab tests. Usually, more medicines start creeping in slowly as the disease progresses. That's why if you want to avoid all of that extra work and concern and cost, doing something starting now is really important.
And is there anything else that you would just like to recommend that people do, how often they should be tested, things along those lines?
Go see your doctor. Your doctor can help you figure out what sort of testing schedule you need to be on if you are at high risk. Often it is annually. If you do not test at risk now but still have some of the risk factors, usually we recheck at least every 3 years.
Well, thank you so much for your time this morning. We are out of time, and hopefully people can take those steps tomorrow in honor of Diabetes Alert Day.
I hope they do.
Thank you. And stay with us.